Okay, we're going to pick up on one of those 5 stories, and we're going to get more on the situation facing one of the province's largest children's hospitals. And on that, we are joined by CHEO's CEO, Alex Munter. Hi, Mr. Munter.
Nice to see you again.
I'm wondering, sir, if you can tell us exactly what the Red Cross will be doing in your hospital.
Sure, and I think a bit of context is important that I think everybody knows that children's hospitals across the country have seen a huge surge in demand, really unprecedented viral season, COVID, flu, RSV. And so we have put a call out to other healthcare organizations, hospitals, home care agencies, and are pleased the Red Cross as well is able to dispatch people to help with this surge. And we've opened lots of new beds, as you mentioned in the setup, an additional ICU, an additional medicine unit, upstaffed in the emergency department. And so it's kind of all hands on deck across the system. So we'll have 2 teams of 9 taking turns coming in on nights. So they'll be in overnight. They are not doctors and nurses, but they will be working with the doctors and nurses as unit helpers, providing support to them. That could be portering patients, getting supplies or medication, that kind of thing to help the units run smoothly. And that's work. Here's the good news. That's work that right now is being done principally by staff from our outpatient clinics. So day staff that are working night shifts. So thanks to the Red Cross teams, they'll be coming in, we'll be able to send those staff back to their day jobs, literally back to their day jobs, right. Which means fewer cancellations, more clinic time, and that's good news for kids and families.
Okay, so the bottom line is that they're backstopping your capacity challenges to deal with the overnight shift, which is quite frankly when I end up bringing my kids into CHEO. It's usually late at night when they get sick, and this allows you to go back as close to normal as you can on the day shift. Am I understanding this correctly?
Well, I mean, we still have a lot of redeployed staff, and
of course.
Last time the other day going through the emergency department, there was a neurologist there seeing patients. On one of the inpatient units, there was a cardiologist. And what that means is that neurologist, for example, had closed her clinic. So rather than seeing kids with seizure disorders or with tics or other neurological conditions, she was treating viral patients in the emergency department. And so really looking past this surge, I think the moral of the story and the important thing as we look beyond the next few weeks is really we need to right size the children's health system in Canada. We've got over 1 million, we will have over 1 million more kids in Canada in 20 years than we do today. And we don't have the capacity for the kids that are already here and for the population that we currently have, I should say. And so, I think that's I hope teachable moment that people are taking from this very, very busy fall in children's hospitals, that it's time to right size our children's health system and in hospital and in the community and mental health agencies and children's rehabilitation centers, for example, so that kids get the timely care they deserve.
I can see the capacity challenges really at the back end. I wonder, sir, though, about mitigation efforts at the front end. I wonder if this situation could have been avoided because we do have that triple whammy of COVID, flu, and RSV, as you were talking about. Could mask mandates in school, broader, mask mandates in public spaces, could some of this situation have been avoided if those public health measures had been in place?
Well, certainly our advice to people has been to mask in crowded indoor spaces, including schools and childcare centers. We are there is not yet a vaccine for RSV, but there is a vaccine for flu. It is a good match this year, and we are presently seeing an increase in influenza. Test positivity rate over the last month has gone from 10 to 30%, and admissions are climbing. So absolutely get out, get your flu shot. And so public health measures are always helpful. But what we are doing and what we need to do is make sure that we have the resources in place to respond to the urgent and emergent needs.
So resources in place, you're looking for more money, more funding from the provincial government to boost staff capacity in pediatrics across Ontario. Is that what you're arguing there for, sir?
Yes, absolutely. Well, and if you think about it, I mean, what's happening here is an unprecedented surge. So, you're not going to build a system to the high water mark, but the gap between where we are and the surge is just too great, which is why we need other hospitals to send nurses and physiotherapists, why we need community physicians, pediatricians, family docs to come in, why we're getting help from the Red Cross, from home care agencies. And so what we need to do is we need to right size the system. And that means a combination of things. It does mean more beds. And so last week, we were really pleased. The government of Ontario announced more critical care beds for CHEO and for other children's hospitals. We need more resources for our ORs so kids don't wait too long for surgery. And really, very importantly, we need better resources for outpatient clinics, medical, surgical, rehabilitation, mental health, and diagnostic imaging. So we're in conversations with government about that. There is good momentum. There have been investments in a number of areas: mental health, critical care, surge capacity for surgery, for the operating rooms. And so we hope that what people take away from this fall is that we need to continue that work and make sure that kids that require medically necessary care get it in a timely way.
So just one quick question before I let you go, because those are all longer and medium-term conversations that need to happen. In the meantime, as you said,
I mean, they can happen now.
Of course.
Well, they're happening now. Yeah.
Yes, but my point was right now you still have cases going up and you still have the Red Cross backstopping your staff. How long do you think the Red Cross is going to have to stay at CHEO?
Yeah. So, the support we're getting from the Red Cross, from other hospitals, from community physicians, from home care agencies, we're planning through the beginning of January, and then we will reassess and see where it goes from there.
Okay. Alex Munter, thank you so much for your time. That's the CEO of the Children's Hospital of Eastern Ontario, Alex Munter.